Hi everybody, Dr. Somareddy here again with the second part today of our upper extremity restrictions. We talked about neck pain before, and I want to add a couple points on shoulder as well. So the shoulder is an interesting joint because it's a ball and socket joint, means that it moves in a lot of different directions, a lot of different motions. It's a bit 3D in that nature, just like the hip joint, which is also a ball and socket joint. There are only two joints in the body that are ball and sockets, the hip and the shoulder. Unlike the hip, the shoulder has less stability. The hip has all the muscles and the weight bearing of the bones that go through the hip joint to keep more stability there. So the hip is more protected versus the shoulder. So oftentimes you'll see shoulder injuries happen by just falling on the floor. You'll find people throwing a ball even, and that it creates a problem from their shoulder. You hear these stories from professional athletes that hurt themselves just throwing a ball or reaching or swinging a certain way. I put some muscles in here today that are very unique muscles that, well, they're not unique, they're just muscles that end up getting into a bit of a pickle when a shoulder gets involved. And I left them there for you guys because you guys can look them up. They are muscles that get very intimately involved with the shoulder and don't allow the shoulder joint to move well. The shoulder has two components, well there's more than two components, but two of the major components are the scapula and your humerus, which is the bone that attaches to your body in general, and the scapula, which is back here, which rides back. And these muscles all have attachments to those two bony structures, and they drive the way the shoulder moves. So without getting into too much of it, these muscles do get involved, and you should look them up and give it attention if you want to learn a bit more about your shoulder. Of course, you can come see us as well, and we can kind of address that with you. But these particular muscles are very important players in the shoulder joint and the course of rehab in shoulders.